Okay, well, I think we can get started. Thank you all, and good morning, good afternoon, good evening, wherever you are in the world. Thank you all for joining. I'm pleased to introduce today's session. This is a joint venture between Glomcon and NephCure that has continued for the last few years in their clinical trial conference series. And continuing the theme of kidney transplant innovation, today's talk is titled Harnessing the Power of Immune Tolerance in Living Donor Kidney Transplant. Our speaker will be Dr. Jill Leventhal, and our panelists will be Anuja Java and Gisela Delgado.
Great to see everyone today. I'm looking forward to a discussion after my presentation and the presentations today. I'm going to go ahead and share my screen. Hopefully everyone can see my screen. If not, please let me know before I jump off here. So this morning we'll be talking about tolerance as a means to eliminate the need for drug-based immunosuppression, something I've been involved with from a research perspective, both translationally and clinically for more than 20 years. You've had my introductions, and here are my disclosures. I currently receive grant support from Talaris Therapeutics, and I'll be talking today about an investigational therapy, the so-called FCR001, that's being developed by Talaris to induce tolerance in living donor kidney transplant recipients. So today's objectives are to better understand the treatment burden associated with the use of immunosuppressive drugs long-term in our transplant patient population, to introduce you to FCR001, the so-called facilitating cell-based approach for engineering donor stem cells to induce tolerance to a combined kidney and stem cell transplant, and to review outcomes of a phase 2 trial that we here at Northwestern were very closely involved with the large majority of those patients being treated here at Northwestern starting back in 2009, and to introduce you to the ongoing Freedom 1 and Freedom 2 studies. Furthermore, to then have a patient-centered discussion here where I'll turn things over to our other speakers for this morning. So turning then to kidney transplantation, and I think we all know that immunosuppressive drugs have really revolutionized outcomes for patients with kidney transplant. Tremendous advances in the use of immunosuppressive drugs. And you can see here on the slide survival probabilities for different types of transplants versus dialysis. And I think it's now very well accepted for nearly all patients with end-stage renal disease who are appropriate surgical candidates and medical candidates, that the best form of renal replacement therapy in terms of improving patient survival is a transplant, with a distinct advantage to receiving a living donor transplant and living donor kidney transplants, although a minority of the transplants we do every year in the United States really provide the best long-term outcomes, although those outcomes are by no means in the long-term ideal, as we'll talk a little bit more about. Living donor kidneys have the longest half-life as compared to deceased donor transplants, and certainly dialysis. But as you can see, out to 10 years, that's still a significant number of grafts being lost. And a lot of these grafts being lost also happen to do to patients being lost. And a lot of this is due to the side effects of immunosuppressive drugs. This is another way of looking at data. Looking at living donor kidney transplant survival, asking the question, how are we doing over time? Are we getting better? And clearly we are. There's been incremental improvement in survival, but we're still seeing around a third of our living donor kidney transplant recipients requiring the need for a second transplant within a decade. And for many of our patients who are young, in their 20s and their 30s, their 40s, this means that they're looking at, at least a second, perhaps a third transplant, with diminishing returns with those additional transplants over time. And so there's this idea of one transplant for life that really has captured our imagination in the field for more than half a century, that through some of the approaches we'll talk about today, and in particular the FCR-based approach, we're beginning to maybe see the